Hi, it's Dr. Fawad Mian. Today I'm going to talk to you about how to get rid of back pain. What are three common causes of back pain? How can you relieve tight low back muscles? And how do you know if your low back pain is serious? Now we're talking about the most common thing that we're all looking for is how to get rid of back pain. Well, there's no easy answer to this, but a couple of things typically may be helpful. Number one, we got to increase mobility. Mobility within the spine, the back, and the rest of your muscles are very important. It's often talked about if your muscles become shortened and tightened, then it becomes more difficult to do a certain physical activity. So sometimes just bending over and picking up and grabbing something can often lead to what's called a slip disc, or commonly what people talk about when they talk about sciatica or pinched nerve, from which you can see back here on the model over here. So getting your mobility better is certainly very important too as well. Posture sometimes makes a huge difference too, and for those folks who are sedentary, sitting down all the time, we definitely want to be getting up, we want to be moving around, we want to be walking around, we want to be able to stretch out a little bit, because if we don't do this, muscles once again become very tightened and shortened, and sometimes it doesn't take much if you're doing a certain activity you're not used to doing where you end up injuring yourself too. Changing your food and your diet often has been talked about too as well. Although there's no perfect thing that's out there, typically more of an anti-inflammatory kind of diet can be helpful. So things you may want to avoid are definitely sugar, things like bread, pasta, rice. That would help manyfold, meaning that would actually help decrease some of the inflammation and insulin resistance, but at the same time would also help you lose weight, which would put less of a load on your lower back too as well. Adding in things like turmeric and ginger into your diet obviously can be very helpful too. That'll help calm down some of the inflammation that you may have. And then there are over-the-counter things that are typically used. Typically they're more menthol-based creams more than anything else. There are also some anti-inflammatory creams that are now on the market that are more over-the-counter as opposed to prescription-based. And while all these things may simply help, they may not be everything that you need to do to get over the hump. But these are some of the easiest things that you certainly can do to try to make things better for yourself and better for your lower back. The next thing I kind of wanted to talk about were what are three common causes of back pain. And so common things can be actually are people who are sedentary a lot, just sitting. And so if you're sitting and have poor posture, your back is more likely to hurt because muscles are starting to shorten. At that point, there's decreased range of motion. So your spine is going to get compressed. So being able to stand while you're working sometimes actually can be helpful. So it actually stretches out your lower back. The other thing that can also happen is that you could also have injuries from picking up things. So if you are repeatedly doing the same kind of things over and over again while you're at work or while you're at home or whatnot, this can actually lead to chronic repetitive injuries that can damage many different things. It's not always just the disc that's kind of popping out. They're actually joints within the back. And so these small little joints eventually can get worn down, they can get injured. And when that happens, that can also act as a generator for pain too as well. So you definitely want to be able to take care of your posture, and you definitely want to be able to stretch out too as well. Another common cause is arthritis, which kind of goes hand in hand with what I was talking about. So arthritis simply, at the end of the day, really just means that there's a bony overgrowth. And a lot of times that bony overgrowth occurs because there's instability in the joints, ligaments or tendons too as well. And when there's instability there, different joints start taking over a little bit more. Things start rubbing away. The arthritic changes start coming about too as well. And then eventually what does happen is then, yes, you can get the slip disc too, as well as other parts of the spine start wearing away and the ligaments start getting torn, and then the disc starts jutting out a little bit too as well. So that's also another common cause of back pain too as well. What are some things that you can do to help alleviate some of the tight back muscles? They can also be things where you are stretching your lower back. And so being able to stretch your lower back with certain poses certainly can be very helpful, whether it's you're using certain positions where you're kind of going from side to side with your hips, for instance, if you're lying down, or even like a cat's cow pose too as well can also be very helpful. Things like being able to stretch out your hamstrings and also being able to try to touch your toes sometimes can be helpful things. Although for some people, they really need to have more of a regimented physical therapy that they certainly have, that can certainly be structured depending on seeing your physician for that. And then the last thing that I did want to touch on too as well was, how do you know if your back pain is serious? Typically, if you're having severe pain, numbness, or loss of function meaning your muscles are getting weak, it's hard for you to bend your foot or push your foot down. You start feeling numbness or tingling within your groin, or you start feeling pain and burning that is going down your leg. That can be severe enough, whereas something is really being pinched off, and that's certainly something that needs to be addressed. And sometimes conservative treatments may not be able to help all these kinds of things, and you may need to have other alternative treatments, or potentially more of a multimodal approach in terms of getting your back pain better, whether that's regenerative treatments in your back or certain types of epidurals that can be done. Ideally, we want to try to avoid anything surgical. For a lot of people, back pain can slowly get better with time over a couple of months, but for those people who do not, there's certainly other options. And if you continue to have low back pain, please come visit our office over here in Denville. And please like or share this video if you found it very helpful. Otherwise, we'll see you next time.